who will go on strike are doing it at their own cost. They are doing it at their own cost because we have a number of people who want to work.
Government is not intimidated by the industrial action issued by allied health professionals, especially Ugandan Nurses and Midwives Union, directing nurses to abscond their duty. Minister for Public Service Muruuli Mukasa says government has had various engagements with different unions on social engagement, but nurses are proving to be stubborn.
In this regard, government is calling on all allied professional health workers, nurses and midwives, to report to duty by Monday, the 30th of May, 2022, and failure to do so, all these workers will be considered as having abandoned duty and resigned accordingly. Chief administrative officers and hospital directors are hereby directed to take stock of these cadres and declare the vacant positions in line with the laid down procedures.
Muruuli declined to comment on the amount of money entitled to nurses and allied health professionals, saying they are to be considered in the next financial year.
The point we have reached with regard to that aspect, it is no longer what it was in 2017. It is a new stage now that we are at, plus other issues which they have been raising, like the schemes of work and so on. All these have been arrived at. And we are confidently stating that the issue of pay enhancement has been budgeted for in the financial year 2022-23. I also wish to add that there is a lot of goodwill.
He advised the allied health professionals to return to work by Monday next week.
Those, of course, who don't return to work will be their choice, and it will mean that they have really given up service in the public health sector, and then other measures can be taken. Then these figures will be out, but I can state with certainty, and the union leaders of these workers know it very well because we have engaged with them, that indeed the pay enhancement, according to the availability of funds, has been effected.
The President Ugandan Nurses and Midwives Union, Justice Chepro Kiplangat, says the government's directive is just intimidation.
Now, since we lie under the category of scientists in this country, it is the only fraternity which has been left out without knowing how much they take home. Doctors have known, teachers have known, but no nurses and allied health professionals have not known. So therefore, we have also exhausted. We have been writing letters several times to demand which percentage does government have for us. Moreover, we are basing on ourselves the CPA of 2018.
Minister for Gender, Labour and Social Development thanked nurses that have followed their profession by treating patients, especially at Mulago Hospital.
I want to appeal to the unions that please reconsider your views and go back to work before the Monday. There are many who are willing to go back to work. Allow them to work, do not threaten them, so that we look for a solution together, because the principle of unions is that you engage, you negotiate collectively.
It has always been a norm by professionals in different unions to use industrial action to catch the eye of stakeholders, especially the government.